I'm going to show you how, in an easy way, we can customize the back support to allow for better posture, better pressure distribution, which in the end of the day is going to increase sitting tolerance, comfort, function, which includes physiological functioning. And targets that comfort that they require on a chair like this. So when we have that kind of more of a kyphotic posture, more typical on clients with aging process, what we really have to do is accommodating this, because if we just allow them to sit in a 90-degree angle as a regular chair, what's going to happen is they are going to slide. So in order for us to do that on the minister chair, we are going to adjust those two areas to remove the padding or the feeling in the midline to accommodate for the spinal processes. We are going to get increased padding, almost like in an angle, to support the posterior side of the pelvis and create that stable base of support. And that what we are going to do is also increasing the feeling of the head support and eventually even push it forward, because the minister chair comes with power head support. How do you do that? I have one back support here open to show you. So these pockets relate to these four compartments. So the idea is really for a clinician, occupational therapist, or a product specialist who is helping a user to have a good configuration and meet their postural care and pressure care needs to increase comfort and function. What you have to do is really just open the zippers, access the inner. You can remove the filling, keep the filling, and later on you can even use the same filling if the client has changing needs and if the client is in a process of deterioration of their posture, for instance. The other thing that you can do is using like side panels for the lateral supports to increase a little bit more, give extra stability, or even increase the rigidity of the lateral supports to make sure if a client leans to the sides over that process of during the day getting muscle of fatigue and leaning to the sides, making sure the client is not going to trigger even more lateral leaning, because when they lateral lean, it will increase the pressure on the ischial tuberosity, which will lead to discomfort and eventually even pressure risk. So the idea is really to have entry-level, quite standard lift chair, but with all the ability to create shapes and contours which will provide more support, better posture, better pressure distribution, and in the end of the day is going to help them to sit for long periods of time in a good position.